Okay, so this is a tour of the audiology clinic at Eastern. Starting off with the audiometer, and this is the test booth. You could see the patient twirling around in his chair through the window. Not supposed to be doing that, but anyway. This audiometer is a computerized audiometer. It can be controlled with the keyboard, or this is the control panel. We talked about the attenuator dial, where you turn the volume up and down. Let me go in here real quick and then you can see it move. So as we turn this knob, the volume goes louder and softer, and then to adjust the frequency, we turn the arrow up and down to measure each frequency. This is also how we select left and right, insert earphones, headphones, bone oscillator, or speaker. So this is all the test control panel. This is a handheld otoscope, or we have the video otoscope that allows us to look in the patient's ear, capture an image of the ear, and store the file in the patient's electronic record. And then if you go in here, we'll see the test booth. During testing, we'll close the door so that it's a quiet room for testing. I guess we'll leave it open for us. Sit up tall. And in this booth, we have the option of high frequency testing. These are specialized headphones for high frequency audiometry, mainly for ototoxic monitoring. This is the bone oscillator. We talked about bone conduction testing. When I put this on a patient, it goes on the mastoid. The bone that's right behind the ear is where the oscillator sits. So we put the headband on, sets right behind on the mastoid part, and the patient hears different tones at different volumes across all of the frequency ranges to determine if our loss is conductive or sensory neural. These are the insert earphones that we place inside the patient's ears. Actually, I need to grab some tips for that. Insert earphone tips are disposable, so you get new ones for every patient. You'll put them on the very end. For diagnostic testing, we usually use insert earphones. Sit up tall for me. Red is right, blue is left. We squeeze the earpiece, or just sort of press it together in your fingers and then put it all the way in the patient's ear. We use inserts instead of headphones because it fits deeper in the ear. It also lets us test without having to mask as much. And you'll learn about masking later on in this chapter. I'm going to take the inserts out. So this is air conduction testing. The headphone, or the bone oscillators, bone conduction testing. These are the sound-filled speakers, where the patient will hear the tone out of the speaker. Got my remote control. When we conduct VRA testing, we present sounds out of the speaker. We localize using, this is video VRA, so we show the patient a cartoon to get them centered, and as they localize, we will reinforce that by playing a little cartoon on the monitor. So that's sound-filled testing, or VRA. And then we also have traditional headphones. I see something. Hold this. So if you don't want to use insert earphones, or if you're doing a screening, we're always going to use this type of headphone for a screening because you're not in a sound treated room. These are better at isolating sounds. Set up. When you put the headphones on, you want to make sure they're properly positioned over the patient's ear and tightened there. For older patients, if they're mature enough, they can respond instead of raising their hand to pushing a button when they hear the beep. This is the response switch. And that's the tour of the audiology booth.